So as Michael said, we're going to be talking about communicating well with your healthcare providers or practitioners. And because as I was preparing for this, it got bigger and bigger, I divided it in half. And the first half is going to be about the experience of living with pain, taking your story to your first visit with a healthcare provider. So how do you organize your information and take it in a format that is going to be helpful for both you and your healthcare provider. And the second part of the talk is going to be about ongoing visits. So once you've made that first connection, how do you communicate with your doctor on an ongoing basis from appointment to appointment, and how do you plan those appointments? So that takes a little bit of forethought. So the first visit to your healthcare provider, before you go, write down any questions as we go along today, because if you're like me with my chronic pain brain, by the time I get to where questions are being received, I've forgotten what I wanted to ask. So please feel free to write them down as we go along, and there will be, as Michael said, time to address some of those questions at different times during the presentation. So let's start with telling your story. First of all, it is your story, and you're the only one who knows it. Because persistent pain is invisible, and you're the only one that can feel it, it's really important that you're able to document what it's like living with pain and take that information to your healthcare provider, and to do it in a way that is useful for both of you. If you look into literature, persistent pain is defined as an unpleasant emotional and physical experience. So the focus of your first visit, as hard as it is to be just on the physical part of your pain. And when we get to the second part of this presentation, we're going to talk a little bit more about the emotions that go with it, because there's lots of those. So the first and most important part to talk about is that pain score or pain scale. Most of the healthcare providers now, especially in BC, which is where I'm the most familiar, are using the 0 to 10 pain scale. 0 means no pain at all, and 10 means the most excruciating pain that you could possibly imagine. I just want to add in here, because I've been guilty of this more than once, when I was really desperate to have my healthcare provider believe how bad my pain was and how big an impact it was making on my life. When I was asked what my pain was 0 to 10, I would jump to a 12 and a 15, because that's my emotions talking, it's my fear talking, and it's that worry that they're not going to believe you. So as hard as it is, try and maintain that focus and keeping your physical pain score in that 0 to 10 range. I actually did tell healthcare providers why they will get 10s and 15s, and it's about that fear that you won't believe what their pain is about, and that they've gone through a lot of negative experiences trying to get there to your desk. So that's why sometimes the pain scores are not out of 10. So with the work that I've been doing with Practice Support Program, which is a committee of doctors, healthcare providers who are trying to put together the best possible tools and help for healthcare providers in the field so that they can be useful or be able to help you a whole lot more. So what they're going to use will be useful. And out of the committee, one of the most common forms that they're going to use to identify what your pain looks like is called the Brief Pain Inventory short form. It has 2 parts. And the first part is obviously a body, parts and sides, and there's some directions at the top on how to fill that out. And the importance of filling that out is when your healthcare provider has a look at that, they can get a really quick idea of where your pain is coming from, whether it's a neuropathic pain or from some other reason. So filling this out, following the directions there, is a really, really good way of letting your healthcare provider get a good idea of what your pain is. When I was trying to move the slides forward, it didn't go and I moved forward too fast. So I am going to back up and pretend that we didn't get there. So what went faster than I realized was what kind of information that you need to take and what you need to prepare to take. And they would be using a separate page, and you'll see some of the charts that we have designed for specifically this purpose, and they will be available on our website. They are available now. So what your pain looks like, and that's what we'll get to the brief pain inventory from. A list of medications, one list of the medications you're taking now, and a separate list of ones that you've tried in the past, because they really want to know what you've taken, what the effect was. So that's an important sheet of information to bring. Also tests. What kind of tests have you had done, and where in your pain story that they were. So you want to start all these lists from the most recent to the most further back in time. And then a list of treatments that you've had, and also a list of operations. There we are. Now it's moving one at a time. So the picture of your pain using tools that your healthcare provider might use, which I did mention already, the brief pain inventory body diagram, is a really good snapshot of what your pain looks like in real time. Using this brief pain inventory form helps measure the impact that pain makes on your life. So here we are back to the picture of the different body aspects so that you can fill in where your pain is. And if by chance you have more than one pain, please use a separate sheet of paper for each pain. If you have an arthritic knee or you have fibromyalgia, use one of these diagrams for each of those pains. It just keeps them clearer and more separate for your healthcare provider to get a better idea. And the second page of the short brief pain inventory form is more about the impact that pain has on your life. And it'll measure what your functioning is. Is your sleep, how is your sleep? Usually most people living in pain, sleep is not good. And it talks about some of your emotions and some of your daily functioning that you're able to do. It's an incredibly, what the word I want is, it's descriptive, but it's also a really good way of getting that snapshot of your pain. That's useful. And you can fill this form out more than once. In fact, you may bring it with you to your healthcare provider's first visit, and they may ask you to do it again, but that's okay, because I do one every time I go to my healthcare provider's office, and it gives me an idea how I'm doing, and it also gives me an idea of where I haven't been paying enough attention. So it is a good thing to do on a regular basis. Okay, the first form that we have here is about medications. And we've designed it with the 5 columns here, which will include the name of the medication, the dose, the frequency that you're taking it. Is it helpful, yes or no, and any comments. So these are the medications, obviously, that you're going to list now that you're taking, and fill those out. And then I've used one here to give you an example. And this sheet you could use for filling out all the ones that you have tried in the past. And here I just put Tylenol number 3 because most people know what that is, and the dose is 2 tablets. And you can take it up to 4 times a day. And is it helpful? Yes, it was. And in this case, it gave this person, or gave me, I guess, because I'm talking for myself, some heartburn. So this is the kind of information that would be on these forms here. Tests, also another important thing to have, because if you've had tests in the past, it's really not necessarily a good thing to do to repeat all the ones that you've had. You just get caught in that cycle of going from test to test to visit, and still just spinning wheels and not really moving forward to help you actually manage your pain. So there are columns here for the test itself. The doctor, if you can remember, you might not remember all this information, but do the best you can. The date that you had it and what the results might be. And if it was a test that you actually had a report for, then please attach that to the back of the sheet as well. Here's an example. This patient had an MRI, and the doctor's name was Dr. Goodman, of course fictional. And it was done in July of 2013, and the results showed that there was a degeneration of the spine. This is an example to help make it clear for all of us. And treatment is the same kind of information, what the treatment was, the doctor or the clinic, the date that you had the treatments, and was it helpful or no. And an example here, these are all fiction, show the prolotherapy of the right wrist by Dr. Fixit, and it was May 2012, and it was helpful. Operations, well, you might not think that that's a really important thing. It actually is, because it adds to the history of the trauma that your nervous system goes through every time that you have an operation or pain or something happens. It actually changes the nervous system to some degree. So it is important to have this information the best that you can. And an example of that, a total knee replacement by Dr. Bones. No laughing about that one. I had to put that in. November 2012, and it was at Lionsgate. So fairly straightforward. So the first visit, in a bit of a summary, is focus on the physical side of your pain, be organized, complete, and bring with you the following documents: the brief pain inventory form, the list of all your medications that you are taking now, and a list of all the medications and the results from all the ones that you have tried in the past. A list of all the tests that you have had, a list of all the treatments that you have tried, and a list of all the operations that you have had. As this is sort of the end of the first half, Michael, I don't know if there's any questions that have come in, or if we take a moment just to see if we have some questions.
Certainly. We have had a few. We've had a question about bullying. What happens when WCB bullies your doctor? We have somebody who's been diagnosed with RSD, chronic or RSD CRPS, and every 3 to 5 years it travels to their hand. Now, ever since their doctor was bullied by WCB, the doctor always sends this patient to an arthritis doctor, which does the test. They come back negative, and they say, and then they state it's more than likely arthritis. You know, I'm not sure that there's much that you can do with this question, but I don't know. Do you have any experience with how to deal with doctors as it relates to the doctor's relationship with WCB?
Well, honestly, that's a nightmare, or can be a nightmare for people. And over the years, I've heard many stories of really tragic stories of fights with workman's comp, and the same kind of thing, bullying doctors. And unfortunately, doctors have been very undereducated about pain over the history of education, and it's just changing now. So your doctor might not actually have the knowledge about pain and why the tests are normal, because what happens with pain, just in a little quick note, is that the pain starts to change the nervous system when it's unrelieved, and those changes are invisible to any kind of test that they can do for you. It's like Dr. Pam Squire is a pain specialist, and she relates it like your computer is your hard drive, obviously your hardware, and you can see it and visualize it, but your software is invisible, and it's the nervous system and the pain messaging system is like that. So that's why your test will come back normal when pain is the issue. If I were talking to somebody that's having this problem, I would just say that document everything, take this kind of information to your doctor, keep a copy of everything, and keep fighting the fight. They hope that you just get tired and step aside, but don't. Whatever you do, don't give up, because it's a matter of miseducation, misunderstanding, and it's nothing that you've done wrong. And that might not be too helpful, but it is a situation that does come up often.
Right. That's great. We have another question that I'm curious about as well. When you're filling your doctor in on the treatments you've received, do you include alternative medicine, hypnosis, acupuncture, Reiki when you're telling your GP about what has been helpful for you?
Absolutely. Those things are among the most important helpful therapies for pain management. Include all of those, and actually that's I appreciate that point, because I will add some of those to the list of examples. They are all things that are very helpful for pain management, and they're all things that you should include. Kudos to you for looking at some of these therapies. There's another committee that's working on system redesign, and I had some comments for them to think about, because when I had my total knee replacement, physiotherapy was just part of the whole package, and I went and I saw the physio, and then I went to group physio, and it was just the way that it was expected that it would proceed. So when somebody gets a diagnosis of chronic pain or persistent pain, as the new language is, part of their management package should be some of these therapies: massage, psychology, because there's a huge emotional burden that we'll talk about in the next section, that people need help with, because these aren't things that are in your normal scope of living. It's bigger than a lot of people can manage on their own. And it's the same with some of the other therapies, Reiki, and my pain brain is causing me to go blank there, but all of the ones that you mentioned, they are very important in pain management, so please include all of them.
And one more, if we have time for it. What do you do when your primary physician does not buy or does not agree with what pain clinics are recommending to you? Do you take the advice of one over the other? How do you decide when you're getting different advice from your GP and a pain clinic?
Boy, that's a toughie. You're going to get me into trouble here. Well, if it was me, and I'll speak from that perspective, because nobody can take me to task for that. If I was in that situation, I would definitely go with the pain clinic's recommendations. And it does go back to the fact that doctors have been so undereducated. The Canadian Pain Society did a survey in 2008, I believe, and they went to all the medical schools and programs for doctors, and they looked at exactly how much education was dedicated to pain in itself, and they came up with 0 to 9 hours. And it's also interesting, with that same survey, they noted that veterinarians get 5 times the education about pain and pain management, because of course their patients are nonverbal. So it does speak to the fact that a lot of family doctors, and it's really not their fault, but education has just been missed in this, and it's just beginning to be included into the programs now. So even though a doctor should be able to take the advice of a pain clinic over their own knowledge, because that's why a pain clinic is operating, because they have a lot more information and research in pain management, that it would be, I think, appropriate that they would follow the guidelines or the suggestions from the pain clinic. I hope that's helpful.
How are we doing for time, Heather? Do you want to address some questions, more questions now, or do you want to take a break later on? It's about 11:25 at the moment.
Yeah, there's 5 more minutes of this half that I allotted time for, so if there's a couple more questions, we probably have time for that.
Okay, we've got a question here about insurance and documentation. We have an attendee here who had a huge struggle with their insurance company and documenting everything and presenting to their doctor. So they write, we have to have our doctor believe us first, and that support will take you further in your battle. Maybe you can talk a little bit about how to best use your doctor in your team as you're dealing with insurance companies. Boy,
this is another difficult one, and I can certainly appreciate how hard it is to be in that kind of a situation. I guess really the first thing that I would do or suggest doing is actually having a conversation with your healthcare provider that you're with at this time, and just say, look, this is my situation. You know me, and you know that this is a real problem. How are we going to work together on dealing with some of the insurances and other, well, we'll just go with insurance for now. How are we going to present it in a united front? Because that's what you have to do. If your doctor's not on your side, it's easy to say find another doctor, but there's so few doctors out there that are taking new pain patients, and there's the ones that are their practices based on pain management don't always have room to get you in a timely way. So that's what I would try first. Is I would just ask for a meeting with your doctor and just say, look, we need to work on this together. What do you think? What are your feelings? What do you think? Here's all the information, and just start there.
Good answer. And we have another question on the challenge in communicating to your physician about what's been helpful and what hasn't. When you have a multifaceted approach, how do you identify if you're taking medications, you're doing this therapy and that therapy, how do you really know what's helping, what's not? Any advice to people on that?
Actually, I do have a better answer for this one. The other ones are complicated, and just that's the way it is. With this kind of a thing, the brief pain inventory, the second page, has a lot of information about how you're functioning. And a good pain practitioner would be as concerned with how you're doing in your daily life, and are you doing more of the things that you want to do. And even if your pain stays the same, that's really quite a success, because you're doing more and your pain staying the same. So actually the things that you are doing are helping to manage your pain and helping you to do more. So using information like that is incredibly helpful for you to be able to say to your doctor, this is what's working. Here's my pain scores. Here's what I'm doing. I'm doing more of these things that I want to do. So this is a success. One of the pain doctors that I know quite well, when she sees a new patient, she will say to them, tell me 3 things that you cannot do now but would want to do if your pain was better. And you write them down, and then in 3 months or 6 months, you go back and you visit those 3 things. And if you are able to do those, or at least partly do those, then whatever you've been doing in that time has been successful, because it's more about return to function than it is about the pain number itself. Because if your pain is a 6 and you're only able to get it around the house and barely outside of the house, then that really needs to be addressed in a big way to get you out of the house, get you doing more. If you're out of the house doing more and being able to plan your days a little better, and your pain is still a 6, that is actually successful, because that is the primary goal, is to get you doing more and get you more active in the things that are important to you. And that brief pain inventory, the second sheet, really gives a better idea of how you're doing in your everyday life. And that will tell the story a lot easier than pages and pages of things will do. So I hope that's helpful to you.
Great. Shall we move on with the second half of the presentation, Heather?
All right. Okay, that was part of the summary. Okay, the ongoing visits to your healthcare providers and how to communicate the best way. So, first of all, your healthcare provider is going to be very challenged for time, as we know. I'm just catching up to my side notes here. So I don't miss anything important to you. So these, the ongoing visits are also going to be building your partnership with your healthcare provider. You're getting to know each other, and what comes from that is a building of trust and a building of knowing each other, and being able to give you the opportunity to be a bit of a leader of your team. Because the 20 minutes at a time is really a challenge for both of you and your healthcare provider. They're frustrated by that as well. But if you can recognize that and bring to that appointment just the most important 3 things that you need to deal with first of all, and then you start scheduling several appointments after that to look after your other pain concerns, and especially these is where some of the emotions come in. So you can make an appointment for once a week. Sometimes you can ask for a longer appointment time where you can have a double appointment. That's possible too. You might want to do that at the very beginning so that your doctor can get to know you and you can get to know how they are going to help you and what their beliefs are, what their preferences are in pain management. So planning is going to be a key here. So how do you take documenting the experience of living with pain? We were talking actually just about the pain and the things that have actually impacted it or been used to manage it as far as medications and treatments go. So now we're going to talk a little bit more about the experience of living with pain every day. And it's going to have things like your activities and movements and sleep, diet, medications, pain scores, emotions, etc. Because pain is actually, the actual physical pain that we've talked about in the first half is only part of pain management. It is obviously a significant part, but it also involves all those other things that are a part of everyday life. So we need something that can take this information to your healthcare provider. And we have worked for over the last 2.5 years as an organization to find a document that will do this job for you in an easy fashion. When we were first starting to do this type of form, the feedback that we got from our pain patients and support group members was that the last thing they wanted to do was focus on their pain all the time. So they didn't want it to be called the pain diary. So that made good sense to all of us on the board. So we changed the title of that to the Discovery Journal. And what this journal does gives you an idea and your healthcare provider how your day goes, how from morning to night. So you can use this form to do 3 separate entries, and you can put it in whatever time of the day that you want. If you're new at discovering your pain and your daily life living with it, I would suggest that for the first while you do this 3 times a day. As you get to be more of an old hat and you get used to planning and pacing and doing some of the things that help your days go a little smoother, then you might only want to do it once a day or maybe 2 or 3 times a week. So at the beginning, it is quite important to do it more often so that you get to understand. And then you can take that understanding and information to your healthcare provider. So if you look in the top left-hand corner, obviously there's a date and a time and the weather. The weather is incredibly important because if you have certain illnesses or certain pain conditions, the weather can play a big part of how well it's going to go on that day. Location, are you at home or are you out and about? What activity you're actually doing. And then to the right, it goes, talks about what emotion that you're feeling at the time. How are you physically? What are your thoughts at the time? And what is your relationships doing? And why these are in there is because stress in our life is going to definitely make your pain worse. It's just part of the way our nervous system works. So part of self-discovering is looking at what your emotions are, what your relationships are during the day. And you can begin to see the relationships between your pain scores at the end of the day. So at the last column on the right, there's any medication that you might have taken during that time. And what is your pain score? And the same pain scale that we were using at the beginning, the 0 to 10. So as you can see, again, you can do that up to 3 times in a day, or you can do it more often if you're really having a tough time. So here's one that's filled out a little bit. It's on the 27th of March. They started at 10 in the morning. It's raining outside. Location, they're out. And their activity is movement. And again, that's a good time to mention that we've taken the word exercise out of most of our literature, because when I think of exercise, I think of the program that I did long before I had chronic pain. And when I think of working out in the gym like that and running for 45 minutes, fear just clutches at my heart because there's no way I could do that. So, but my memory of what that exercise word means to me is not a good reaction to have within my body, because then it's going to put out my stress. So we've labeled most of our things activities or movement or just being more active. So this person wants to do or does 30 minutes of walking. They're happy. They're physically they're feeling pretty good. Their thoughts are, it's really nice to be outside, and relationships are good at this time, and their pain score is a 4, and at this time of the day they did not have to take any medications, or it wasn't due. So then the next entry later on the same day at noon this time, it's still raining outside and they're still out, but they're doing some shopping. And while they're out, they think you may as well stop and get some groceries. So they're getting the groceries there. Their emotions are still good. Physically, they're not good now, but they're okay. And their thoughts are, oh, shopping is hard, grocery shopping, oy, oy, oy. Relationships are still fine. They took a pain medication at noon, and their pain is up a little bit. It's 5 right now. So later that day, at 7 p.m., the weather is dry now. They're at home. They're resting, watching television. Their emotions are good. Physically, they're pretty tired now. The thoughts are, you know, I really think I did a bit too much today. Relationships are still fine. They took their pain medication that was due, but their pain is a 7. So on the next slide, I want to show you how you can use this information to adjust what you do in a day. So they did movement at 10, and then they went on to shopping. And then when they're looking at this Discovery Journal entries, and the pain is a 7, so their thoughts are, you know, maybe I did 2 busier activity things back to back is what probably caused my pain to flare up a little bit. So the goal is to keep it obviously down and close to the same baseline level so that there's no big ups and downs. So what they could do to adjust this is they could either put in a restful activity between these two, or do the shopping on another day. So you will be the director of your own discovery journaling, and you will be able to decide how best that is going to adjust to you. Because the goal, as I say, is to keep your pain down a little bit, not up to 6s and 7s and 8s. So the Discovery Journal is like a snapshot of your average day, which will help you and your healthcare provider to see the relationship to increase pain, and actually most importantly to what is helping reduce your pain. One goal for keeping a Discovery Journal is to learn what lowers your baseline pain. You wanted to keep it down around the 3s and 4s if possible. You want to prevent the flare-ups up to the 7s and 8s, and you want to maintain a positive energy level. In our pain toolkit, we talk about pacing, which is a lot about keeping a positive energy level and balancing your activities so that you're not doing 2 more active activities at one time, which is what happened to this person on the Discovery Journal. And the pacing, see, there's pain again. That flew right out of my head what I wanted to tell you. It was about in the pacing, like if you relate your energy to a cell phone, if you let your cell phone run down to 0, you're going to have a hard time charging it back up. But if you stop it when there's 20% left in your cell phone battery, it's going to be easier to charge it up, and you've got a little bit in reserve for in case you really need it. So with family phones or your children's phone and you have to go and pick someone up or do something for yourself or your family members, you have that little bit of leftover energy there for those types of situations. So doing the Discovery Journal is also part of helping yourself learn how to pace and how to keep that energy there. Another goal is to have a tool that both you and your healthcare provider can use to plan your ongoing pain self-management strategies. It's a great document for using with your brief pain inventory because it's about functionality and this is about functionality. Remember that you may spend 20 minutes with your healthcare provider this month, but the remaining 43,180 minutes every month are yours to self-manage. this slide is getting to be used in a lot of places just because it really illustrates the reality of pain management. So ongoing visit planning. I think it went ahead one too many again on me here. No, it didn't. Okay, so planning anything at all, any of the research or documents that we've researched, use the SMART plan to do planning of any kind. So SMART stands for specific, measurable, action-oriented, realistic and relevant, and time-based. So a little bit about each of those. Specific, obviously, is exactly what it is that you want to achieve. Measurable, you need to be able to track your progress and measure your outcome. It needs to be action-orientated, so it has to be written or goal-orientated, quite specific to the steps that you're going to take to do that. Realistic and relevant, the objectives should be challenging, but realistic and relevant to your condition. It has to be within your ability to actually do that. And time-based, so the objectives should have a time limit to it. And here's an example that will help clear that up a little bit. Specific, this one is written up, it's on increasing daily activity. And so being specific, this person has written, I'm going to add movement to my daily routine by walking. So there, walking is the specific activity. Measurable is written, I will achieve 30 minutes comfortable movement each day, and I'll record my efforts to show my progress. In the action-orientated column, they put, I will build up my stamina by walking each day. I will start with 10 minutes once a day. I will add either more time or a second walk each day, depending on how my body responds, until I reach my goal. And under realistic and relevant, they are confident that they can follow this plan. They are motivated to improve their health and enjoy getting out and about. And time-based, I will complete this goal in 4 weeks. So it shows that they know exactly what they're going to do and how they're going to take those steps from the beginning to the end. It's obviously something that they feel confident that they can do, and they're going to do from the beginning to that 30 minutes a day in 4 weeks. So planning, obviously you're going to be doing daily planning, and you'll use your self-discovery journal to do some of that. But when we're getting back to the doctor's office and planning appointments, you want to take the issues that you really need help with and write them down in the order of importance. And then in one of your appointments with your healthcare provider, show them your list and say, this is the things that are really important to me to work on. Which ones can we start with, and which ones can we comfortably move to the next appointments? So this will help both your healthcare provider and you to know what your whole list of things that you want to do are, and then you're both are going to be comfortable that you're not going to expect or try to do too many in one appointment. So this again at the bottom of this slide shows again those 3 things that you want to do if your pain was less, and this can determine if your overall plan that you're making with your healthcare provider and following together is actually accomplishing what you want to accomplish. So the emotions that are incredibly important with pain management, because again, the definition is that pain is both a physical and emotional experience. Emotions can cause extreme amount of stress within our body, and that stress is not going to be helpful for our pain. The nervous system and emotions are so incredibly interconnected that it needs to be a high priority in pain management is looking after some of the emotions that are very common for anybody who's living with pain on an ongoing basis. And some of these emotions may include issues around acceptance. Grief is huge. Grief for the losses and changes that are part of your life of living with pain. Anger, guilt, fear, and depression. So these emotions are just as important as the physical items that we had listed in the first half of taking to your doctor. So a couple examples that we put on here. This person is quite angry, and the feeling around that anger is frustration, and it's moderately affecting their life. So these three columns on the right side are severely affecting, moderately, and minimally affecting their lives. So another emotion that they've listed down here is they're frightened, and they're feeling trapped. Their limitations are quite severe because their pain is preventing them from doing some of the things that they want to do. So these emotions and this feeling is severely affecting their everyday thoughts around their life, right? So those are the emotions that they're getting in trouble with. There was a great video I watched a couple of weeks ago, and it was a psychologist talking about emotions and acceptance and about the stress of these emotions and what it does to our bodies. And the fight-flight response that is part of our nervous system and part of the pain messaging system, when we have emotions that are high and severely affecting our thoughts, they are also going to affect our pain management because it's going to continually activate that fear-flight response, which is not going to help your pain scores at all. In fact, it's going to be causing them to be worse. So I can't overemphasize how important it is to take care of yourself, take care of your emotions, make sure that you actually address these with your healthcare provider. In most people's life experiences, they don't learn how to look after a chronic condition. We have acute conditions like a broken leg, and you get a cast, it heals, you get better. People fuss over you and help you, and they hold open doors because you're on crutches, and you get the degree of sympathy that's appropriate for the injury. And you get better and you go back to normal. But with persistent pain, there is a whole lot of work to be done around grieving the losses and then building a new normal. We could do a whole webinar on that, but I really want to stress that looking after yourself and looking after your emotions is a huge part, an important part of pain management. So that being said, other useful tips in your ongoing appointments that you've made with your healthcare provider and you've done it together as a team. Be a good listener. Listen to what your healthcare provider is saying. Write it down if you need to. Be a clear communicator, and if you take information as we've outlined in the first half of the webinar, and the reason I ask you to do each one on a separate page, if your healthcare provider wants to pull out information on just your treatments or just your past medications, they can do that easily. So it is important to do it in that kind of a format. So you're going to be a clear communicator in what you bring to the office and what you convey verbally to your healthcare provider. So write down those important points or suggestions even before you leave home if you've got a couple of questions, because again, if you're like me with chronic pain, the most important thing that I really, really wanted to ask or find out about, I forget. So come with your things written down. Your healthcare provider will be happy that you do that. If you're listening and you're not sure what you've heard, please repeat it back and say, have I got it right? You can request for any written information that's available. Often in the waiting rooms, there's brochures in those storage places there. I hate pain brain, the words that you want don't count. Anyway, in the brochures in your doctor's office, there might be some really good information about other resources that are there. Take a family member or close friend with you who can be your advocate and help remember what is discussed. Sometimes if they ask you how you're doing and you're the kind of person that says, fine, I'm fine, really you're not fine. And somebody who knows you really well can add to what you give and say, well, you know, you've been so exhausted lately that you're falling asleep anytime you sit down. So those kinds of things, an advocate can help you remember and help pass on that important information to your healthcare provider. Again, ask for any written material, resources, or other organizations where you can get information or support with others who share similar problems. People in our support group find that they're a tremendous source of resources and information about those resources, and just being able to share the frustration and the difficulties of living with pain together with others who do understand. So ask for the information about those kinds of things. Be confident that you can be the leader of your support team. You're the only one that knows your pain story, like we said at the beginning. So you're the one that has the responsibility of bringing that to your healthcare provider in a clear and concise manner. If you bring a book-size document to your healthcare provider, they're not going to look at it. They're not going to get the information that you want them to have. So be confident that you can do these things. And build your support team. You want to add members, can be professional, family members and friends, people from support groups, some of your alternative therapy people, massage, all those kinds of people can be on your support team so that there's no good number. You keep adding more and more people to that support team. Okay, actually, we're kind of at the summary now of the second part. How are we doing for time? Oh, perfect. So a summary then of the second part. Sorry, Michael.
No, you go ahead.
Okay, is bringing your brief pain inventory. Again, from my work that I do on the PSP committee, which is a program support program for doctors that are building pain management tools. This is the one that they are suggesting is one of the better ones to use. It won't be the only one, but it's one of the good ones. A discovery journal, planning and goal setting, and a list of your emotions. And then work with your healthcare provider to plan your pain management strategies, set up appointments, and list the items that you want to deal with at each appointment, and decide together what the most important issues are to begin with. So, yeah, there we are.
Great. Well, we have time for a couple of questions. Are you okay to answer a few more, Heather? You've been so generous with your time with us today.
I'm fine. I sort of put a half an hour to each half, and so that it's 11:53. So yeah, we've got 6 or 7 minutes. I'm fine with that.
Great. Somebody asked about apps, smartphone apps for managing pain. Have you heard of any? Do you use any that are useful to you? Any advice on that?
I do know of some that are in construction or being put together. I think it would be awesome if we had something like that, especially if you can document your pain in real time with an app like that. I think it would be awesome. So I don't know of any at the moment, though, for sure.
Somebody asked about the video that you mentioned about pain and emotions. Do you recall where you saw it or what it was called?
It was in one of our newsletters about 3 weeks ago. There was a link to it, and you could also put the link on our homepage on the website. I put the slide up on there for information on either asking me more questions later or our website, where all these forms that I've talked about are downloadable for free, and the information about that video is there. It's a link to it. It's a YouTube, and it was incredibly powerful about the process of getting rid of some of that stress that's around acceptance and how it frees you up to be able to cope a whole lot better. So it was a wonderful video. I played it at my Comox Valley support group last week, and there was tears. It was a very touching video and really struck home to a lot of people the importance of working through the emotions and not just being stuck in them. So if you can, have a look at it. You can download it at home on your own computer. So
wonderful.
Great video.
Wonderful.